This is Dr. Marty Klein with more Sexual Intelligence. Today I want to talk about sex with a new person. You're having sex with a new person. Do you feel excited, anxious, self-conscious, lonely? Are you enjoying the sex? With a new person, that might not be your main focus. Some people are so busy trying to do it right, or not to do it wrong, that they don't have much bandwidth available for pleasure. And that's why sex with a new person can be so disappointing. 3 factors shape our experience of sex with a new partner: communication, self-consciousness, and the use of alcohol. Let's look at what many people experience the first time with someone new and how to create something better. So, number 1, sex hurts. Regardless of gender, sex can hurt for a lot of reasons: uncomfortable positions, insufficient lubrication, chronic pain, and people trying or going along with activities that they aren't in shape for or don't know how to do. People know they're supposed to stretch before they ski, run, play tennis, or play the piano. Almost nobody stretches before sex, and nobody does that the first time with a new person, and that can make sex uncomfortable. Whether you're having intercourse, anal play, hand jobs, or using toys, making dry things wet and wet things wetter is the solution to a lot of difficulties, including pain. Not using lube because you shouldn't need it, or you're embarrassed, or you don't want to insult your new partner, that is an unfortunate mistake for which people typically blame sex rather than themselves. So what to do if sex hurts? Stop and talk. Okay, so number 2, you have erection problems or he has erection problems. Erection is a hydraulic response, the end result of a chain of events that go from brain to spinal column to pelvic nerves to blood vessels. Ultimately, more blood then flows into the penis, which presses against the walls of the penis, and like a balloon filled with water or air, the penis gets firm. When someone feels nervous, guilty, or uncomfortable, those emotions, which are electrochemical moments in the body, can interfere with that brain, nervous system, vascular system handoff, and that results in losing an erection or not getting one in the first place. That doesn't mean you can't have sex, but when it happens the first time with a new person, there isn't always enough communication to negotiate a satisfying sexual connection. Worse, too many guys assume that, oh no, I have erectile dysfunction, ED, which complicates future erections. Number 3, insertion is a hassle. Of course, not all sex involves intercourse or putting something into a vagina, anus, or mouth, but if sex does involve one of those things, a lot can go wrong. Too many people are trying to put thing A into hole B in the dark, or without discussing it, or with insufficient lubrication, or when they've been drinking, or without understanding simple anatomy. Vaginas don't extend 90 degrees to the body. Penises don't necessarily bend the way we sometimes demand that they do. The diameter of the anal opening and the sphincter's one-way design isn't nearly as big as the things that some people want to put through it, like a penis or a handy household object. Even mouths aren't as big or deep as we sometimes want them to be. Insertion with communication can be gentle, cooperative, and pleasant. Insertion without communication rarely is. Number 4, it isn't like the sex you see in porn. Real sex cannot feel the way that porn sex looks. I say this all the time. Real sex can't feel the way that porn sex looks. Porn sex has the advantages of editing, lighting, scripting, and people discussing scenes cooperatively while planning off camera with Viagra, lubricants, enemas, and so on. Porn sex isn't real in the same way that Star Wars and Harry Potter aren't real. All 3 are entertaining, but none of them provide a blueprint for what life will be like. Porn generally involves unusual bodies in unusual situations doing unusual things. The realest thing about most porn is the credits at the beginning. Next, you feel a lot of pressure. You're not even sure you want to do it. Some people talk about performance anxiety with a new person. What's just as common, but talked about much less, is feeling pressured, agreeing to sex when you don't really want to, or doing stuff like choking someone or letting someone come on your face or doing stuff that you don't want to do. Some people have trouble saying no, regardless of context. They're always complaining about how hard it is to get Mary off the telephone. So they acquiesce rather than make a scene. Their emotional issue goes way beyond sex. Note that if someone has trouble saying no, their "I guess so" shouldn't be trusted. Other people want to kiss, touch, or cuddle with someone new, but want to stop there. If they don't think that stopping is a legitimate choice, they may find themselves going further and unable to intervene. A patient occasionally tells me, "I didn't know the other person well enough to talk about what I did and didn't want," which clearly means that person wasn't ready to have sex with this new person. And of course, when people drink a lot, they often do things they regret. Blaming alcohol for unwanted outcomes is a poor excuse for adult responsibility, even if you've been exploited by someone else. Next, you don't have an orgasm. This can be true for anyone, young or old, regardless of gender. The reasons vary. You aren't getting the stimulation you need, you're nervous, you're afraid of unwanted pregnancy, you've been drinking or using drugs, you're concerned that God disapproves of what you're doing, you don't want to lose control with a person you don't trust yet, or it's the side effect of a medication such as an antidepressant. Note that orgasm is not the most important part of sex. It only lasts a few seconds, and it can't possibly compensate for sex that's boring, annoying, or scary. Orgasms are nice, but the rest of sex should be. And if it isn't, orgasm is unlikely. And even if orgasm does happen, it can't redeem the rest of what just went on. So again, there are 3 keys to making sex with a new person more enjoyable: communication, self-acceptance, and limiting alcohol use. Managing those 3 is the easiest way to create a first sexual experience with someone so that you'll want a second one. Well, I'm Dr. Marty Klein. Thanks for joining me. You know, I drop one of these videos every 3 or 4 weeks. So if you want to hear from me, click subscribe, click I like it, and you'll get pinged when I drop the next one. Thanks a lot for joining me.